Living with an overactive bladder, impacting approximately 33 million Americans, overactive bladder is a widespread concern. Have you ever pondered the cause behind those sudden urges to urinate that disrupt your day? In the United States, overactive bladder affects at least 40% of women and 30% of men. Stay tuned to discover swift solutions and regain control. What is an overactive bladder? Overactive bladder induces a sudden urge to urinate, often causing involuntary urine loss. Affecting around 33 million Americans, it is more prevalent in women. The unpredictable nature of overactive bladder can lead to social limitations, impacting quality of life and causing emotional distress. Fortunately, various treatments exist to manage symptoms and improve overall well-being, reducing the incidence of incontinence. Overactive bladder affects at least 30% of men in the United States. Many cases in men are linked to an enlarged prostate, a condition more prevalent in older men. Overactive bladder affects at least 40% of American women. While the cause is unclear, overactive bladder becomes more common in women after menopause, possibly due to estrogen deficiency. What can you do to minimize the symptoms? Your dietary choices directly impact urinary health, potentially aggravating overactive bladder symptoms. Carbonated drinks, excessive fluid intake, and drinking before bedtime can heighten the risk of irritation and increased urination frequency. Gluten sensitivity, caffeine, and certain foods like citrus fruits, spicy foods, and artificial sweeteners may exacerbate the symptoms. Keeping a food log can help identify triggers, and exploring nutritional supplements may aid in managing symptoms. Treatment options: pelvic floor physical therapy. Specialized therapists target pelvic muscles with exercises to manage urinary issues like urgency, frequency, and nighttime symptoms. Medication: drugs such as tolterodine, trospium, and mirabegron focus on symptom relief and reducing urge and incontinence episodes. Possible side effects include dry eyes, dry mouth, and constipation. Botox: small doses temporarily weaken bladder muscles, reducing overactivity symptoms. Effects last 6 to 8 months, requiring occasional retreatment. Nerve stimulation alters nerve signals to the bladder through electrical stimulation, potentially relieving frequency and urgency. Methods include inserting a wire into the lower back or a needle into the lower leg. Surgery considered if symptoms persist. Surgery aims to increase bladder capacity when other treatments prove ineffective. Managing an overactive bladder involves doctor-prescribed treatments and lifestyle changes to reduce surge frequency. If experiencing symptoms, consult your doctor for a personalized treatment plan, as overactive bladder is often underreported. Thanks for watching and see you next time. If you found this video informative, check out this video next.